So the emergency department at Mayo Clinic Rochester is a level 1 trauma center. We see approximately 80,000 patients a year. We are seeing patients that do have COVID. And as you're well aware, patients can present with a myriad of symptoms, and that then creates the need for a significant amount of personal protective equipment that is being used. Hi, my name is Chris Russi. I'm one of the emergency medicine consultants here in Rochester, Minnesota. I've been practicing emergency medicine here for approximately 13 years and graduated from residency back in the early 2000s. I'm excited to share with you our article that was recently published in Mayo Clinic Proceedings entitled Emergency Medicine Telehealth for COVID-19, Minimize Frontline Provider Exposure and Conserve Personal Protective Equipment. And so our article goes into our process for standing up and a description of how we stood up our telehealth program within our own emergency department. So what we did is deployed Microsoft Surface Pro devices to every one of our emergency department rooms. And Mayo Clinic has already had a long-standing contract with InTouch Health. They provide our software and some hardware solutions for the telehealth activities that go on across our organization. And what was interesting about our article is the amount of PPE we saved in a very short time frame. So as you work your way through the article, you'll see that we do have from late March to the beginning of May, so approximately 5 to 6 week window, we had over 3,500 uses of the telehealth system, which then in our minds you could potentially translate to 3,500 plus PPE equipment not being utilized and reserved, and also potentially 3,500 3,500 healthcare workers that are not necessarily exposed by being at the bedside. Now we're using telehealth in emergency medicine, not necessarily for the primary evaluation. You still need to see the patients. We still need to do a robust physical exam. But when you consider in an active, highly complex emergency department, how many times we're having an interaction with patients, we are in and out of a room continuously. Nurses are in and out of the room, the physician work staff, our provider work staff, we are constantly revisiting patients. How are you feeling? Are we making progress? Updating them on timelines. And so that is an opportunity for exposure each time you're into the room, and it's an opportunity to use PPE. Patients that can't communicate with us, that are unresponsive, have altered mentation, are not reliable in their ability to communicate, we have to presume that they may have it. So we're geared up for every one of those interactions, especially on the trauma side too. And if we have to anticipate needing to provide emergency airway management, which is an aerosol generating procedure, then yes, our threshold to be ready is very low. We're all gowned up and covered for all those interactions. For those that are either walking wounded or have other complaints that are able to communicate with us their symptoms and what they've been experiencing, there are times when we don't have to gear up necessarily. But given the significant amount of symptoms that COVID can cause, yeah, we're seeing a significant amount of PPE utilization to protect our healthcare workforce. And if this is an opportunity to save that for future surge, then fantastic. We hope it does well. So when we're able to link into the room virtually through a video mechanism, visit the patient, we can see their vital signs, we can ask them how they're feeling, do they need anything from us? That's going to save PPE, and it's, I think, gone remarkably well. We're going to continue this on, and as I forecast out to the future, in a post-COVID world, when we enter into periods of time when we have high influenza surges or other significant communicable diseases, this may be a mechanism to help mitigate exposure and save personal protective equipment. I think it's here to stay because we're not only seeing the benefits just because of the pandemic crisis, but the cost avoidance and the convenience for our patients is extraordinary, right? So when you consider a rural health population who has challenging access to get into a primary care physician or see a specialist, telehealth now can bring those folks to you. we joke with this phrase, the patient will see you now, right? And it really opens up access and the potential to see providers that you might not have access to or have a long way out on a scheduling platform to see somebody. So you don't have to travel, you don't have to get a hotel room, right? There's a significant savings to the patient. There's a time savings to the patient. You can do these visits relatively quickly. Yeah, I think it's going to be here to stay, just not only because of the pandemic, but on the financial impacts that healthcare organizations are seeing by deploying these strategies. We also talked briefly in there about how this is could potentially be used in our pre-hospital system, in our 911 ambulances, our response vehicles, and how we can help and augment our paramedic crews within this pandemic environment too. So. I hope you enjoy the article. The brief results on the utilization we found were interesting. Our staff here have embraced it, and I think telehealth is clearly here to stay, and it's going to augment how we provide care in our emergency department. So I really appreciate the time, and thank you so much.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.